So we're going to start with a 5-minute video, which is the commemoration of the 2nd anniversary of the Oslo conference. I'm not sure if it's called conference or summit, but instead of having another conference, the decision was made to create a video, and it was also shown during I think at ECOSOC, but we'll show that. And then we have a very exciting agenda today. And we will be starting after the video with Mendy Marsh from Voice about the report, We Must Do Better. So I think we can start now. We have 40 people on, and that might continue to grow, but we'll start now with the video. And just to say, the video was put together with a lot of collaboration. Maybe Philippe, you can just mention who else collaborated and give a bit of an introduction. And this is Philippe, who's our communication officer from the GBV AoR.
Hello, everybody. Oh, thanks very much. So the series of 3 videos actually was put together and to commemorate, as Jennifer said, the 2nd anniversary of the Oslo conference. And I think it was very much, they were put together to show some of the achievements that had been accomplished, but also show some of the challenges that remain. And the first video you'll see, it brings together some of the leaders of the different organizations that were instrumental in Oslo. So not only was the GBV AoR kind of working there, we had UNFPA, of course, we had ICRC, we had UN OCHA, we had Norwegian Christian Aid, we had International Federation of Red Cross, and there's a few other organizations that were there as well. So maybe we'll just show the first one and you'll see which leaders took part there. So Shiva, can you play? We don't have volume, do we?
No, there's no volume yet. Oh, yeah, yes, there is now.
siinaa badbaado iyo taageerid nafsaani ah kuwa ka badbaaday tacdiyaadka ku saleysan jinsiga guri nabadoon oo aan ku leenahay Muqdisho. La taliyayaashu waxay kaloo kala taliyaan si ay u helaan cadaalad marka ay u baahdaan iyo marka ay diyaarka u yihiin. Haweenka waxay lugeeyaan masaafo aad u dheer si ay u gaaraan adeegyada maadaama ay aad ugu yar yihiin adeegyada dalka gudihiisa. Sanadihii hore guriga nabadoon waxaan ku caawinay 924 dumar iyo gabdho isugu jiro. Kuwaani dhammaantooda waa kuwa ka badbaaday dagaalada iyo dhammaan tacdiyaadka kala duwan ku saleysan jinsiga. Waxaana si joogto ah ugu baahannahay taageero si aan ugu dhaweyno adeegyada.
2 years ago, the humanitarian community, including governments, women's rights activists, and survivors united in Oslo. A commitment was made to eliminate sexual and gender-based violence in a humanitarian crisis.
Shiva, could you actually play the main Talking Heads video? Sorry, that was the one for the Somali activists. So we had 3 executions.
I am.
Just a second.
We had one from Somalia, as you just saw. We had one from South Sudan, and we had the heads of all the different agencies as well in one execution, framing all the different issues that were at hand that still needed to be addressed.
The horrors of violence, including sexual violence, affects millions every day around the world.
Humanitarian agencies have a duty to confront these atrocities. That's something we all have to do.
The voices of women and girls at risk often go unheard. yet they should inform everything we do.
SGVB affects at least 1 in 3 women and girls and many men and boys. The risks are greater in crisis, conflict, and detention.
The social, psychological, and economic impacts are long-lasting and have been compounded by the COVID-19 pandemic.
Yet only 5% of the financial needs have been met so far this year.
2 years ago, the humanitarian community, including governments, women's rights activists, and survivors, united in Oslo.
We are committed to eliminate sexual and gender-based violence in the humanitarian crisis.
So these are all up on our social media streams, on our Facebook, on our Twitter, and on our YouTube channel as well. So you're free to use them if you'd like, and to make sure that the word gets out about them. So thanks very much, Shiva. There's also the third video on South Sudan, but we'll probably not show that right now unless there's time later.
Okay, let's see if there's time at the end. And this was right before Mark Lowcock has left OCHA, so this is sort of the last statement from him with his championship on women and girls. So I want to just housekeeping, remind everyone if you can put your video, your microphone on mute if you're not speaking, and then you're welcome to write questions that you may have during the presentations, write them in the chat. If the chat doesn't work for you, then when we have questions and answers at the end of the presentation, you can also speak up if you don't have access to chat, and you're very welcome to just talk, which is also very good. So we are going to move on now to Mendy Marsh. Some of you may remember her from her work prior at UNICEF, and she was one of the founding mothers of the GBV AoR a few years ago. I won't say how many. And now she's doing really exciting work with women-led organizations, and they did a lot of consultations for a report that came out a couple of months ago now. Mendy, maybe you can say when it came out, but I will turn it over to her, and she works now for Voice.
Hi, everyone. Thanks for having us. I'm here with my colleagues, Virginia and Sharanya, and they're going to do the bulk of the presentation. So Voice is a newer organization, and we really exist to support women and girl-led organizations. We're working to address the systemic violence that they face because they are women and girls, and really see ourselves as uplifting the voices, the lived experiences and realities of women and girls in partnership with women and girl-led organizations. And so this is our, Virginia, you can go to the next slide if you want. We really see this publication that we launched in March as the first of a, year-on-year series of reports that we'll do that will help amplify the realities of women and girl-led organizations, networks, and groups, and working and living in humanitarian or crisis and conflict affected settings. So this is really the first of many reports that we will do to help people understand the unique realities that they face, how we really dug into how COVID impacted them and the work that they aim to do, and how they, despite all the rhetoric around localization, we really are, we have a very long way to go in relation to addressing the needs of women and girl-led organizations, because we know that they are the front lines of crisis and the ones who are really often doing the lion's share of the work, but this work and this leadership often goes unrecognized and misunderstood. So this report is one of the first that we hope will help people understand. I know this is probably not news to a lot of people in this group, but I think the larger community, including you know, the leaders that were just shown in the video previously, that they really need to understand that if we're not supporting the women and girl-led organizations the way that we can and should, that we really are never going to meet the grandiose sort of commitments made through Oslo and also through the you know, the grand bargain and localization commitments. So with that, I'm going to hand it over to Virginia first.
So hi everyone, thank you for being here. As Mandy was saying, this report, the We Must Do Better report, has really intended to lift the voices of those women who have been resilient when they shouldn't have had to be. So truly there is nothing in this report. We could have predicted the gender consequences of the COVID-19 pandemic, because these consequences have been evident from the outset. We had over 20 years of experience around the gender dimensions of disasters, and also knowledge from previous public health emergencies. And yet we have decided to ignore them. So in summer 2020, we heard from over 200 women and girl activists, leaders of organizations and groups across 41 different countries, to dig into how COVID-19 pandemic has impacted women and girls and their organizations, including the ability to secure and access funding. So now we will share a link on the chat, so you can download the research if you haven't already, and if you want to, of course. So what we want to share is that we have observed very worrisome, but at the same time not surprising, a global consistency around the findings, even if, of course, there are context-specific issues. Women worldwide had similar concerns and experiences. And here we wanted to quote our colleague Heather Cole when she said that patriarchy might come in different outfits, in different contexts, but the dynamics in which it manifests are really not different. So I'm going to go ahead and share the findings, which are clustered in 3 different interconnected themes. The first one is the access to and control of resources and assets. So not only women have told us that there was a lack of resources, but also when these resources were out there, were inaccessible because they are being allocated in ways that don't make sense to women and girl-led organizations. For example, the lack of flexible funding mechanisms. So at the point of this research last year and still now, many organizations are still waiting to hear about funding decisions, and half of the respondents have not received any additional funding to help with the response. And even so, many of these organizations have just been trying to sustain their activities and adapt to their services regardless. So it's about economic assets and food security. So at the same time, women reported significant job losses, decreased incomes, and a struggle to keep their businesses afloat. So when these incomes were declining, women said that they are now and that they were very likely to go hungry and distribute their share to children and elders in their households. Another main difficulties shared by participants was about the pre-existing technological gaps and that disproportionately affect women. So many women and girls inside and outside organizations reported constraints, access to their own devices, also the internet, and even lacked skills to use technology effectively. So, and the most problematic thing is that these barriers translate into women being unable to access trustworthy information about the pandemic and also about available health and support services, and ultimately to organize and survive. We saw how women's collective movement building and activism are being weakened, as well as their capacity to act as a result of patriarchal isolation. Freedom of movement and association limitations during the pandemic have altered the sense of community that is rooted at the very core of these women and girls organizations and groups. So the second theme is about care and the care that is demanded from women and the care that is expected from women to provide to their families, communities, and also in the workplaces. And this care is enormous. So as we have brought out, not only women are poorly cared for, but also cared about, and they are supposed to do this with no support or resources because there is this global idea that care is something that women will just do naturally. And especially we can measure this by the resources that women get, or in this case, that women do not get. We have seen that resources dedicated to women's services, including GBV and sexual and reproductive health services, have been redirected to efforts to respond to the pandemic. So this shift of funding priorities is happening in a context with increased levels of violence against women, in particular, intimate partner violence. So it demonstrates how women's concerns are always seen as secondary. We are saying with this, we are saying that women do not matter because resources from GBV services are disappearing when women most need them. And last, the pandemic, together with lack of resources, increased isolations and care responsibilities, limited movement in a context of heightened violence can be devastating in the consequences for women and girls' mental health and their overall well-being. So now I'm handing over to my colleague Sarania that we will walk you through the rest of the report and also the recommendations.
Thanks so much, Virginia. Just picking up from where Virginia paused in terms of care work, what the third theme that emerged strongly from a lot of the findings when we analyzed the findings, the third one that was really interesting to us was that of social expectations and norms, and how strongly those patriarchal social expectations and norms were driven in and exacerbated women's experiences during the pandemic. Whether it was looking at care work, whether it was looking at who would drop out of the formal economy first, whether it was looking at who was expected to take on certain kinds of burdens or who would give up food. We were really pointed to time and time again that the underlying social norms and expectations were really at the root of how women experienced the pandemic and experienced the resulting tensions and issues from it. Next slide, please, Virginia. So in terms of recommendations, how we framed the recommendation sections of the report was really also looking at partner organizations, largely the large development sector and aid organizations, who, because often of power dynamics, don't hear these voices from women and girls on the ground. Either they don't feel like they have the relationship to come and tell organizations this, or because of the way things have been structured, they're concerned that if they do say something, that they would be cut out of processes. So it was really interesting to see how this very specific role that voice is able to play, because we are not a donor, we are not, we don't have that same power dynamic with these organizations, how much they were freely able, or felt that they were freely able to open up to us and sort of talk about some of the things that they had been struggling with that they hadn't felt they were able to talk about before. So the recommendations were framed in this context and understanding that sort of power dynamic and that relationship. I'm not going to read off the slides, but I did want to say that sort of what came out so strongly over and over again was really simple, smaller actions that are often undervalued because they seem simple and small. So something, for example, like just talking to the women and girl-led organizations and hearing from them what is the most practical solution on their behalf. So for example, something we heard from organizations was that they had budget lines allocated for transport, and they were struggling to communicate with partners or donors to turn those budget lines into data, into purchasing data for women and girl-led organizations to attend virtual meetings. I remember a trade unionist in Sri Lanka told me that a lot of organizations thought that what was needed to communicate information were fancy graphics that looked and sort of were pretty and were appealing, but most of these organizations are passing this information around on WhatsApp groups. And each of those graphics are like 3-4 MB at a time. And they were like, you know, we'd much rather just have a text message that we can forward easily. We don't need all this fancy like looking stuff. We just need to get the information out there. And this is eating into our data. So often we formulate suggestions or policies or practices from the perspectives we come from, which doesn't always reflect the ground realities. So you can see the 6 recommendations primarily that are up on the screen, but I want to draw attention particularly to this connection of so to 2 things. The first is connection of groups to build sustainable movements. Most groups talked about how isolated they felt. It was overwhelming to us how many groups said that they didn't feel they were connected nationally or even regionally to other groups, and that they felt they were sort of battling and struggling this on their own. And that was really heartbreaking to think about, especially as we think about building a sustainable movement. And that was something that really came out strongly to us in terms of building networks, helping women and girls connect to each other, because sometimes it's only when they speak to each other that they even realize this is a concern or something that they're struggling with. And the second thing I wanted to bring up was this idea of care as a priority. The kind of language that these groups used when they talked to us was, you know, saying that we are stretched to the limit. We are just at the end of our tether, because they were not only, the nature of these groups is that they're not only providing a service, they're also emotionally and sort of socially supporting so many of these women and girls. These organizations have become safe spaces and drop-in centers and just spaces for women and girls to connect emotionally with each other and, you know, feel removed from the isolation. And that emotional toll that it was taking, the pressure they felt to keep their staff on, the pressure they felt to continue to provide above and beyond what they had, was startling, and I think is a really important consideration in terms of care and how care plays out within these organizations, not just in the private space, but also in terms of the organizational space. I'm going to stop here, and I think we can take questions, and maybe Virginia and I will answer them as best as we can.
I'd also, if people want to make comments, we have a great combination here on this call of coordinators from a number of different countries, as well as core members. And I also saw that we had Viviana, who's from a women-led organization in Nigeria. So, you know, I want to also invite, if you want to, if this resonates with you, if this is something that you want to add, to also feel free to make a comment. And I see that Karina wrote in the chat, Karina's from the CASI project, that she, you know, really agrees with this point about making data available and changing budget lines is something that came up also in the consultations that they've had with adolescents in the CASI project. But Viviana, I don't know if you wanted to add anything from your side. I'm not sure how your connection is, so I don't want to put you on the spot. But
yeah, Jennifer, thank you so much. Can you hear me?
Yes, we hear you perfectly.
Yeah, I'm happy to be part of today's meeting. I've tried severally, but I have not been part of the meeting, but I'm happy that I'm part of it today. Actually, as it's been said all through, I have one major point that has been a concern, especially in a GBV intervention of a research. Apart from the humanitarian aspect of it, we have some communal clashes and other conflicts within the communities, which has also increased GBV incidences in our communities. And addressing such issues have been challenges, especially to us as female-led CSOs. For instance, we had an issue of incidences from communities where there have been attacks, and then because they are not in the insurgency-related areas, they have little or not much attention regarding GBV issues. So you discover that much of the burden is laid on us as partners. And if we are able or privileged to have access to funding, mostly is limited to specific areas. We can't go outside the box because the budget is limited to such activities. So bringing some of the issues or the cases from communities where it has happened to the state headquarters in order to have the basic facilities is not always easy. So I felt the funders should also take into cognizance some of these issues or the bottlenecks in handling GBV issues, not only in insurgency or in humanitarian setting, but also in other issues that have no relationship with the humanitarian sector. Thank you.
Thank you, Viviana, for those points. And Fiona, I see you put something in the chat. Do you want to just say it?
Sure. Yeah, I was just wondering about, and I know it was just one practical example, there are probably many others, but just to dig into that a little bit in terms of women and girl-led organizations, what they felt was behind things like those, that lack of flexibility or some of the power dynamics there. So, you know, in relation to how women-led organizations are being treated differently in those interactions. And so things like changing budget lines that, you know, flexibility would usually be a normal part of partnerships. Did they feel that there was, you know, kind of particular things related to patriarchy or racism that were driving some of that kind of lack of flexibility in how donors and partners are interacting with women-led organizations, if that makes sense?
That's a great question. Sharanya, maybe you want to take that one. I think that there's a lot there's a lot mixed into that question, in fact. Yes. But there's a lot we need to unpack, and we will be doing deeper dive thematic reports that we've been working on. We'll be launching soon. But Sharanya, do you want to take a first stab at answering that question?
Sure. Thanks for that, Fiona. I think that's a really important question, especially in terms of, you know, how the patriarchy sort of reinforces itself in these situations. Another example I can pull from the findings that may kind of give you more insight is that a lot of women and girl organizations talked about how women's care or health that they had fought for so firmly, to have specific dedicated women's centers, were then turned into COVID-19 centers. So the first things to kind of go or be sacrificed to the greater pandemic was women and girl-led or women's centered organizations. So for example, I mean, I come back to the example of Sri Lanka, is that domestic violence was not even considered to be an issue or something they should worry about because there's a greater pandemic, there's a bigger issue to worry about, was the language used. We heard this a lot in terms of healthcare, for example, that women talked about women dedicated centers or clinics or spaces were the first to be sacrificed to now be run as COVID-19 centers. So they felt that they were always, like, the gains they had fought so hard to have were always treated as like it can be taken back at any time. And during COVID-19, that was really shown with so many of those things because they were the first sort of heads to roll, as it were. It wasn't sort of mainstream health centers or anything like that. It was immediately like, oh, we can take over the women's clinics because, you know, that's the first month that's going to go. And that was really interesting to see how patriarchy reinforced itself because women are always seen as disposable.
And I would say that, you know, one of the big things is the women very clearly said, like, of course we're not being consulted in COVID response. We've never been consulted before. Why would we be consulted now, right? Given all the sort of pressures around response to COVID. And Viviana, I just wanted to highlight too on your comments. I mean, I think that represents in so many ways that we still just aren't listening to women and girl-led organizations. We're not sort of orienting our efforts around what they know is the reality and that they know who's most at risk and where resources do need to flow. I think that donors often are not taking the time to even have those conversations often with their grantees to really understand the reality and how much wisdom and knowledge women and girl-led organizations hold. And I do think that we can't, Sharanya noted it, but we can't underestimate the importance of how fearful some organizations may be to raise any challenges, because it may mean that what was already really hard fought resources that were already limited will be lost in that sort of conversation. So there's a lot in there to unpack, and I hope that we can continue, kind of uplifting these really, acute realities that we need to help the humanitarian system understand and figure out how to better address.
Thank you, Mendy. Constance, I see your hand is raised. Unfortunately, we're already about 12 minutes over. So I'm going to suggest that you write your question or comment in the chat, and we'll make sure it gets answered. And I want to really thank Voice, and you're welcome to join us for the rest of the call. And if we have time at the end, perhaps we can pick up some of these additional questions for discussion. And thank you, Virginia and Charanya, for joining, and nice to see your faces. And I know with Mendy, we've been talking about this for a long time, so we would definitely want to have you guys come back in a future call and give you a longer time, because I think really we can have a lot more conversation on this. So really we will welcome another opportunity. And I want to turn over now to IRC, because we actually ran out of time with them the last time. So I want to make sure they have their adequate time. So IRC is going to be presenting from the CASI initiative, and it's Tizia who will be presenting, I believe. Great, nice to see you on our screen. Tizita, so I want to give you this opportunity to present from the CASI, the Child Adolescent Survivor Initiative. So over to you.
Thanks, Jennifer Chase. Hello, my name is Sista Tekletzadik. I'm a child protection, gender-based violence, child survivor specialist, working with IRC and based in California. So today I'll be really presenting briefly about CASI learning program. So CASI has an operational team from the learning and from the coordination. So my colleague Jennifer Lee is also have joined us, and hope many of you are familiar with her. And from the coordination, we have Vivian and Karina. So the CASI learning program that I'm going to share is like our phase 2 program implementation in South Sudan, Nigeria, and Yemen. So as you see from the program model, the CASI learning program has 2 major pillars of objective. One is like the technical capacity building that goes for CP and GBV supervisors and manager, and building their technical capacity around case management through case management coaching and supervision, caring for child survivors training, and at the same time through a series of individual and group coaching sessions. So that's technically with the technical capacity building, which really trickled down during our learning program to the caseworker, because we technically focus on supervisors and manager. But in the meantime, GBV and CP caseworker will also have the opportunity and exposure to be trained by, to be trained by the supervisors and managers who are trained by us. So the supervisors and managers who are trained by us provide the same training on caring for child survivors for their respective caseworker, and at the same time provide a regular supervision and coaching.
So sorry to interrupt, but I don't know if you want, the slides are not moving, they're not progressing. We still have the main slide on the, so I don't know who's controlling the slideshow. I don't know if it's you or someone else, but
yeah, it's my, yeah.
Okay, great, thank you. Sorry to interrupt.
How about now? How about now?
Now we see the slide that has the diagram on it, like little flow chart.
That's where I am. Thank you.
Perfect. Okay, great. Thank you.
So like the technical capacity building approximately will take 8 months because it also include like a training around the case management coaching and supervision, caring for child survivor trainings. And at the same time, we coupled it with individual and group coaching session for 5-month series of session. But in the meantime, during those training and also group and individual supervision and coaching, we expect supervisors and managers to provide the same training to their respective caseworkers. That's one of the objectives. The second one is really focusing on CP and GBV actor capacity building to their case management in general about their service to child and adolescent survivor. With that, we have selected in each country, like in Yemen, Nigeria, and South Sudan, 2 national NGOs to implement CASI project for 3 months with a total of 30,000 budget for each national NGOs. And their focus is more of really technical capacity building for their respective caseworker, and at the same time, improve their case management to child and adolescent survivor. So just to go through like each country, what has been done through CASI learning program. So in South Sudan, we have trained around 29 colleagues from UN agency, international NGOs, and national NGO on CP and GBV case management, coaching, and supervision. And then we have selected out of 29, around 70 participants from international and national NGO who proceed with the entire learning, which means the CCS training as well as individual and group coaching sessions. So once we provide those capacity building trainings, we coupled it with a series of individual and group coaching sessions for 5 months, which are based on the priority that has been made by the learning participant. So it's more of like to really go in depth on their coaching skills in terms of really providing this group coaching session. So from South Sudan team, once we provide those basic training, they prioritize that there are lots of challenges in working with like around coordination, psychosocial support around the assessment piece, and also the intervention, self-care and staff well-being. They thought it's really less prioritized among CP and GBV actors. So they would like to deep dive around those things through group coaching session, early marriage and forced marriage, boy sexual abuse survivors, and child survivor with disability has been prioritized by the learning participant to go through in depth through group coaching session. So far we have covered around 5-month session, and we're planning as well, since we have the time for South Sudan in particular, we're planning to also add 2 extra months to cover some of the things because we took a little longer time on some of the prioritized topics. So once we have done this, in the meantime, the learning participant, since they have got really the basic training and also go through individual and group coaching session, they have take those action points and plan to cascade the same training to their respective caseworkers and peer organization or sister organization through like capacity building training, and at the same time, group and individual coaching session for their respective caseworkers. From that, as I said earlier, we have a sub-award to build the CP and GBV actor. So for South Sudan, we have selected UNIDO from Child Protection Agency and AYA from GBV agency. Both of them are national NGO, and they've got the opportunity to provide the same capacity building training to their respective staff, as well as improving their case management processes and also approach to address the differential needs of child and adolescent survivor. And both of them have already like at the end of their project implementation period. So like with South Sudan, since we all have almost at the end of the project period, they're also working on their sustainability plan. So one of the partners came up with the sustainability plan and also following up with the implementation. So in relation to sustainability, they are really thinking forward and also start to implement around integrating major CASI program activities into their existing CP and GBV projects by integrating some of the learnings into their case management to child and adolescent survivors through their Women Girls Wellness Center, Activities Temporary Counseling Center, and etc. And the other one is working closely with local authorities and Ministry of Women, Children and Social Welfare to integrate some of the existing activities in the government existing structure, because one of the partners is also planning to hand over some of their case to the Ministry of Women. So they are really working on in terms of with the existing local authorities. The other one internally from their end, they are working to really include some of the CCS component into their capacity building and also coaching session to their respective case worker. And also like they are advocating further for service provider, donors and working group to just really like advocate for differential needs of child and adolescent survivor. Yeah, currently they're also working on it and plan to improve it, like collaborating with other actors to provide CCS training to other service providers, government stakeholders, including legal, police, health actors. So this is like one of their sustainability plan, but in the meantime, they have also provided CCS training for 3 service providers, one of the partner, and the other one has also included in their specific operational location, have included 2 more service provider from the national NGOs. So Yemen, in terms of implementation, we have really like engaged, as you see, like a lot of partners, around 13 partners from UN agencies, international NGOs and national NGOs. And we give more like an opportunity for national NGO because it's more of like designed to really bring the leadership of national NGOs and also to bring their voice and at the same time build their technical capacity. So we have, as you see, like a number of national NGOs here. So recently we have around 32 colleagues who are participated during our launching workshop, which is really focused around designing a learning agreement between facilitator and also learning participant. And at the same time, really focus around like what are the humanitarian partnership principles, what are the diversity, inclusion, equity, because we really would like to integrate it into our training, in the entire training, as well as the group and individual coaching session. We have provided as well and trained CP and GBV case management, coaching and supervision training. And recently we're somehow like in a week break between the training. So in July, we'll be starting the CCS training and it will be followed by individual and group coaching session. So in Yemen, all training provided remotely with Arabic interpretation and also like all materials, training materials, additional resources have been translated and shared with the learning participant. So recently, in relation to the second pillars of the program around the technical capacity building to CP and GBV actor, we have selected 2 national NGOs, Yemen Women Union and Sustainable Development Foundation, SDF, to be partner with us during the CASI learning program with a specific implementation for 3 months. And with 30,000 USD with a focus on technical capacity building to their respective staff and improving their case management to child and adolescent survivors. So similarly, Nigeria is our 3rd country for CASI learning program in phase 2. We have started around 2021 in the new year. So the launching workshop has been done. And at the same time, we have proposed for call application and around 15 national NGOs have applied for the capacity building as well as for the SEBA award. And for technical capacity building, 7 international NGO has also applied. So recently we have pre-selected 2 potential partners, RHHF and CPPLI from CP and GBV actors from the national NGOs. And we have conducted pre-award assessment. So we're expecting training and coaching session to be done around July. So this is just like a glimpse of a brief implementation about CASI learning program in 3 different countries for phase 2. And we are also expecting a lot of learnings, documentation and lesson learned, and hopefully we'll share broadly at some stage later on, down the line before the end of the project. So we really would like to really appreciate GBV and CP coordinators and CASI focal points within the country level AoR in South Sudan and Yemen as well, Nigeria, because they have really provided a lot of technical support, guidance based on context-specific knowledge and experience to the CASI learning program. So we really would like to shout out for their support and guidance throughout this process. So what's left is from the CASI learning program is we are also planning for CP and GBV community of practice to relaunch this quarter. Maybe Jane can also say a lot about this and also CCS resource package.
Jennifer Lee, I think that's you. Were you going to add something?
Sorry, can you hear me?
Yes, now we can hear you.
Okay, great. Yeah, so just, I think my camera is not working. Hi, everyone. Just briefly, so for those of you who are in the CP-GBV community of practice, we've been kind of pausing on relaunching just as we sort of rethink through kind of how we're moving forward with CASI and what would be the most valuable for everyone. But as Sudhita said, we will be relaunching this quarter, so please stay tuned. And then the CCS resource package, that's basically directly developed from the coaching sessions, the group coaching sessions that Sudhita shared about already. So taking sort of from the prioritization of the different colleagues in the countries that we're working with, and then kind of creating more packaged coaching modules from the ones that we developed for those sessions, and then sort of having a phased approach of development and then sort of piloting in the new context as we begin the coaching in Yemen and Nigeria. So yeah, I'll pause there and then happy to take any questions, but back to you, Sudhita.
Yeah, I think this, thank you all for, really listening to us. And if you have any questions, suggestion, we welcome and appreciate it.
So I don't see any hands or questions in the chat, but if somebody would like to just ask a question, I know not everyone has access to the chat or the hand raising icon. So please feel free to ask a question directly. Just unmute. You can all unmute yourselves if you have a question. Okay, so feel free to still, if you have a question, to put it in the chat, and then I would ask our IRC colleagues to go ahead and respond in the chat, which is what Sal Mendy was responding to Constance's question from the last presentation. And so we're going to now, thank you very much. And it was really great to hear these details of the project, and we look forward to hearing more as it continues. And I will now turn it over to our other CASI colleagues who are part of the child protection and GBV area of responsibilities. And they're going to be presenting on the barrier analysis that they've been doing, and they are, with them, are joining the implementing partners for responding to the barrier, identifying the barriers and then looking for ways to respond to them. So I'm going to turn it over to Vivian and Karina, and I will ask you to present your implementing partners as you present. Thank you.
Thank you so much. Can you hear me okay?
Yes.
Yes, I can hear you, Karina.
Great, thank you. So I will start us off and introducing the CASI Child and Adolescent Survivor Initiative, the barrier analysis, and then introduce my colleagues in the Philippines, Wilbert Sayulga, Carl Onmig Bagod, supported by Leah Grace. And then from there, we'll have, hey, Leah, we'll have Vivian Kosh, who's the CASI coordinator for the GBV AoR, and Millicent Chiruki, presenting from the Philippines, from Kenya. So yes, if we share that picture, can we go back one more, please? So just a little introduction. So we have the participatory barrier analysis in two settings, Zamboanga in the Philippines and Kibera in Nairobi, Kenya. And the project, it's basically looking at engaging with adolescents throughout identifying and addressing barriers. We do this with the objective to generate a deeper understanding of the barriers, the impact, and what type of barriers there are for child and adolescent survivors to access multi-sectoral services. And the idea is also to develop a replicable methodology for meaningfully engaging with adolescents, identifying and addressing barriers. So I'll quickly hand over to the Philippines and Leah.
Hi, good evening. Good morning, everyone. Good evening. Let me hand you over to our two core group who were with us they take the lead for the barrier analysis project. Actually, they are the core of the barrier analysis project. So Wilbert and Carl.
Thank you so much, Ma'am Leah, Ma'am Karina. Good evening. To all our honored guests, different agencies and stakeholders, mentors and consultants, and fellow adolescent facilitators who are gathered in this Zoom meeting. Buenas noches, días a todos. Good morning and good evening to each and everyone. This is the participatory barrier analysis for the adolescent survivors' access to multi-sectoral services, which is located, or the setting is from Zamboanga, Philippines. I am very grateful to be one of the participating adolescents in this project. I am Wilbert B. Sahulga, 19 years of age, from Zamboanga City, Philippines, and together with me is my colleague, Carl.
Mute. No audio.
And together with me is my colleague Carl Wamig F. Bagod, who is also one of the core facilitator in this participatory barriers analysis project. Next slide, please. Thank you so much. So this is the background of the BAP, or the Barriers Analysis Project. The aim of the project is to identify barriers and improve the quality of, as well as the access to services for child and adolescent survivors of sexual violence, ages 10 to 19 years old, through a series of focus group discussions, key informant interviews, workshops, and other methods, as spearheaded by a core group of adolescents organized for the project. So the participatory barriers analysis project aims to have participatory approach, which means that we, the adolescents, are the leading group throughout this project. We are the one who's leading throughout this project. And one of the aim is to have a better understanding of the access barriers that the adolescents face within our locality, which is Zamboanga City. Because as it was said, Zamboanga City is the sixth most populous and third largest city by land area in the country. And it is really diverse and adolescent with regards to the ethnicity, religion, socioeconomic status, the sexual orientation, the experiences of violence, displacement, and humanitarian agencies. And some of these sexual violence cases that are happening in the locality are really undocumented. And one of the aim is also to develop strategies to increase the adolescents' access towards the programs and services that is really relevant in terms of accessing the programs and services which they are experiencing about with regards to sexual violence and gender-based violence. And also this aims to have methodological development of a participatory approach, which means that the adolescents with the core facilitators and also with the guidance of the members of the BAF team and also the stakeholders which have a participatory approach throughout the barrier analysis project. Next slide, please. So the phase one. So phase one happened last November, started November and until May. However, we started the phase one or the focus group discussion, which was stated earlier last March 2021 during pandemic. So the phase one, it has issue selection and it also have the development and implementation of an assessment design, which we, the core group, have developed the 10 questions with regards to the focus group discussion, which were conducted also by us, the core group facilitators, because this barrier analysis project also entails the participation of the adolescents and really empower the adolescents to become leaders in promoting changes in the city and in the community. These 10 questions were utilized in the focus group discussions and key informant interviews which were done by the adolescents. The focus group discussions were done through arena because we are having pandemic and virtual setting, just like having Zoom and Google Meet, is very relevant in this present situation that we are facing. And the identification and prioritization of actions by adolescents and stakeholders to affect desired change. During the phase one, the adolescents and the stakeholders have their interaction in terms of what are the barriers that our fellow adolescents are facing in the locality. Why are these programs and services were not accessed by our fellow adolescents? And throughout the focus group discussions and key informant interviews, we have around, I think, a total of 312 participants all throughout our focus group discussion, which are also adolescents. And the oldest participants or the oldest adolescents is 19 years of age. And throughout the focus group discussion, we have a very productive and engaging talk with our fellow adolescents, and through that, we have known that there are really issues and concerns that our fellow adolescents are facing wherein they cannot access these programs and services due to some due to some cases which will be presented later by my colleague. And the prioritization of actions by adolescents, these are the steps and these are the results that have gathered all throughout the focus group discussion that will really give change and really give impact to the programs and services that are present in our society, that will strengthen the programs and services to really give awareness to our fellow adolescents that they are really heard and they are really catered. And the phase two, the implementation of youth-led change actions to address identified barriers to access, which we are now having our phase two. We have started it yesterday. We have the strategic planning workshop for the core members. It is a 3-day event and workshop which the core members, have also come up with that so that we will be capacitated and we will be trained if so that during the month of July, August, and September, when we are having our training on the grounds, or we will be having our information dissemination, we are trained and we are really capacitated through that. We are trained about project management, how to handle case management and referral mechanisms, and really what are the needed orientation and workshop capacitated so that in the phase 2 or the implementation of these activities, we, the core adolescents, are capacitated to lead and to spark change in the community. Next slide. Thank you so much. Yes, Carl. I am handing over this presentation to my colleague, Carl Wanmi.
Yeah, hi, sorry, Wilbert. It seems like there was a misunderstanding on the time. And we have about 10 minutes left for CASI altogether, and we still need to have Vivian come in with Kenya. So if you can try to wrap up your part soon so that Vivian and Kenya has a chance to speak, that would be great. Sorry for the misunderstanding.
I think, Bert, you can just read it so that the time we don't have more time.
Yes, Carl.
Just read it, Bert.
So these are the barriers to access. These are the results all throughout our focus group discussion. There are the access to information, the family support and social issues, the referral mechanism and structural processes, and lastly, the child-sensitive case management. So these are the barriers to access to information, and these are the results that were gathered all throughout our focus group discussion. And last slide. So these are the prioritized activities that we, the adolescent core group facilitators, have come up. So the number one, the use of social media to increase information dissemination and access to services. Number two, the conduct of advocacy activities to improve family support and address prevalent social issues. And lastly, the conduct of refresher course and trainings for stakeholders and service providers, and the formation of a multi-stakeholder case conference to address issues on referral mechanisms and structural support, along with child-sensitive case management. Carl, do you have any additional
Yes.
input?
Bert, am I audible? Bert,
Yes.
am I audible? Thank you.
Yes.
So, thank you. So this is based from the 4 findings, we come up at 3 prior planning. So the first is the creation of Facebook page. Since adolescents nowadays are exposed on social medias such as Facebook. So through the creation of Facebook page, this is to increase information dissemination when it comes to the rights of adolescents, what are the age range of adolescents and such. And also this can be a platforms to know how to access the services of the adolescents. So the second prior planning that we come up is to conduct of advocacy activities to improve family support and address prevalent social issues. So here there are 2 activities that we come up. First is the strengthening family development session. So it depends
Carl, you have to stop.
Okay, mom.
Don't have time anymore. So Karina, hand it over to you.
Okay, mom.
Sorry
you so
about
much.
that misunderstanding.
Yeah. Thank you. Please over to Kenya.
Sorry, hi, I've been talking to myself. Okay, I'm going to invite in Millicent Kiruki to come and present on behalf of Kenya. She's the research focal point person for LBCT Health, and she's Kenya. So welcome, Millicent, and the floor is yours. Make it short as you can.
Okay, thank you so much. Shiva, could you please help us put up the slides? Thank you. Yeah, so my name is Millicent. Good morning, everyone. Good afternoon. And I'm going to take you through the preliminary findings of the CASI study in Kenya. And I would just like to start by appreciating a number of collaborators who have made this project possible. And that includes UNICEF, GBV AoR, and UNFPA. But we also have some Kenyan government institutions that we have been working very closely with. And this includes the Department of Children's Services in Nairobi and the the County Health Management of Nairobi as well. Next slide, please. So our CASI project has been implemented in Kibera. Kibera is the largest informal settlement in Nairobi. And the reason why Kibera was picked is because it has a number of risk factors for violence. And this includes things like poverty. The place is quite densely populated. So children and their caregivers actually live in very small spaces. So there is no privacy. There is high unemployment. So the rates of violence are actually quite high in Kibera. The study objectives, we had 2 study objectives. So the first one was to explore the barriers to disclosure and formal services seeking for adolescent survivors of violence. But we also wanted to understand the barriers from the perspectives of the service providers. And for the service providers, we looked at providers in health, providers in the criminal justice system, and also providers in the children's office who provide post-violence services to children. So in terms of the people that we engaged in the study, we talked to adolescents, survivors of violence between the ages of 12 to 19 years. And we also talked to their caregivers because of the key role that they actually play in supporting children to access services. And finally, we talked to the multi-sectoral service providers. And I would like to mention that we actually took protection measures to be able to protect the adolescents who participated in the study. And just to mention a few of the things that we did is that we engaged research assistants who are competent in doing research with children, but also being able to inquire about sensitive topics such as violence. And then the other thing that we did was to just ensure that there was privacy in the venues where we conducted these interviews, because we wanted to make sure that children who have gone through violence do not suffer any further harm as because of being part of our research. And we also had counselors available for any child who experienced distress in the course of the research, and even any child who required to be linked to counseling services, requested for it, or even for those who didn't request, we were able to give them contacts to be able to reach out to a hotline, should that be required. Next slide, please. So I'm going to dive right into the findings. So the first thing we talked about was disclosure barriers. We know that disclosure is normally the first point of a survivor, an adolescent, or even a child being able to get help. And some of the barriers that they identified included poor parent-child relationship. And some of the adolescents actually expressed that they were afraid of their parents. And some of them said that they were afraid that if they disclosed to their caregivers, they would not be believed and they would not be supported. And they thought that they would even be blamed for the violence that had occurred to them. There were also a number of children, especially the boys. We also talked to some sexual minority groups. Those are the gay boys. And they did talk about experiences of shame and stigma associated with violence. And they actually had like triple stigma. So the fact that they were engaging in gay sex, and some of them had actually been sodomized. So it was very difficult for them to share those kind of experiences with their caregiver, or even to identify a trusted adult that they could talk to. And a number of children also talked about their fears of being treated differently by adults or even their peers if they found out that they had experienced sexual violence. The other barrier that was also discussed is threats from perpetrators. And some of the adolescents had actually received threats from perpetrators just to try and silence them so that they do not seek for justice. Next slide, please. So here I'm going to share with you more barriers in terms of now adolescents seeking the formal services, and by formal services, I mean going for healthcare or reporting to the police or even being able to pursue the cases in court. And one of the barriers that was reported is lack of knowledge. We found that adolescents and their caregivers had limited information about available post-violence services. And for many of them, they thought that the only thing that a survivor needs to go for is a HIV test. Yet we know that all the multi-sectoral services are really important for survivors to be able to recover and to heal. The other thing that was also reported is being blamed by service providers, and service providers did not know how to inquire about violence, and some of them would actually ask why questions to the adolescents. So asking them, why did this happen to you? And it would lead to them feeling like they were to blame for the violence that they experienced. The other thing we also heard from the adolescents is the lack of friendly services. And many of them talked about how the doctors and how the police ignored them. And they would sort of talk to the adult who had accompanied them. And there's a quote there that I would like to read for you. This is from an adolescent boy who is a survivor of sexual violence. And he said, "The doctor did not tell me, he told the people who are with me," and here he was referring to the adults. "What did he tell them?" The interviewer asked. "I don't know, it was private. They told me to stay outside and wait for them, just that." So they would sometimes be ignored, they would not receive information about the services that they were being given or even the medications that they were receiving. There were also reports of corruption and settling of SGBV cases out of court, where perpetrators and their families, together with the survivors' families, would sit down and agree on a settlement. And most of the time that would be a financial settlement, so that then the case is not pursued to get justice. And finally, there was also the issue of limited resources, the lack of transport. Some of the service providers were located a little bit far from where, from the Kibera informal settlement, and they would have difficulties getting to the service points because of lack of transport. Next slide, please. So these are the gaps now from the perspective of the service providers, the multi-sectoral service providers. There were many gaps, but I'm just highlighting some of the key things that came up. So they did mention that there were few psychologists, and this was a challenge because we know how important counseling is to be able to address trauma after violence. And the other challenge that was there was limited resources, and this was really mentioned across the different service delivery points. And by limited resources, I'm talking about finances, but also human resources. There were also mentions of communities' lack of trust or faith, especially in the judicial system, because the SGBV cases take a very long period of time before they're actually resolved. It could take years. And so this makes people feel like justice is not something that can be achieved. Other barriers included having few shelters, and the shelters should be a temporary solution, perhaps as a child awaits for the perpetrator to be arrested, especially in those cases where the perpetrator is someone who lives within the same household with the child. And so the service providers did mention that they had few shelters available, and some of them were also not aware of what to do, what process to follow to be able to get, to link a child to a shelter. Then finally, poor multi-sectoral coordination. We have so many service providers in the informal settlement providing post-violence services, but we do not have somebody who is coordinating or sort of monitoring the kind of services that are being offered, or even somebody who can resolve conflicts that occur in the referral process. Next slide, please. So this is my last slide, just to share with you some of the solutions that we are proposing as a project. So one of them is the constitution of an SGBV committee. And this SGBV committee should have representation from the various sectors that offer post-violence services. And we do think that this would be a solution to resolve the issues in the referral network, but also to be able to monitor and make sure that children's safety and welfare is upheld. The other thing is being able to map the service providers to come up with an updated directory that each of the service providers can use to be able to refer children between health and the police, even the shelters and the children's office, and even other community resources that can support children after violence. The other thing is capacity building. I did mention that there were knowledge gaps, so we intend to have capacity building of the various service providers on adolescent and survivor-centered approaches. And how we hope to do this is by taking a multi-sectoral approach, so that then they can get a platform where they can clarify their expectations and even point out some of the bottlenecks that they do experience when they're referring between the different points. And then finally, for the community, we also hope to come up with targeted capacity building or awareness creation. And why we say targeted is because there are gaps that caregivers have, which will need to be addressed. They need to learn what violence is, what to do if your child experiences violence, how to support your child, how to respond, and even the available services. And for the adolescent, that kind of awareness will still be important for them to be able to understand what violence is, and for them to find out what services they can access and why services are important. And finally, even for the community leaders, we hope that this process would be community-led, so that then it can be sustainable beyond the life of CASI. Thank you very much for your attention. I'm going to hand over back to Vivian.
Thanks so much, Millicent. And any questions?
Yeah, I'm afraid we're not going to have
comments. I can hand over to Jennifer for that.
Yeah, so thank you all. I mean, this is a super interesting presentation from both the Philippines and Kenya, and learning about the barriers, and we look forward to learning more. I've suggested, because of our shortness of time, if people can put their questions into the chat, and then I think it's good if you can respond to those questions in the chat, and then we can provide longer responses afterwards. And then just to say, we are going to move over to Libya, that's going to present their GBV secondary data review. We've been trying on these calls to have a combination of presentations on field missions, presentations from our coordinators, from core members on new tools and resources. And so we're going to hear from our coordinator in Libya now. I appreciate that we've really retained a number of our participants. If you can stay an extra 5 minutes so that we can hear the full presentation from Omar El-Farouk from Libya, that would be great. If you need to jump off, we understand. And also just to say, Sarah Mosley has put the upcoming Community of Practice event in the chat, which is tomorrow. So please do look at the chat for the IRC presentation on PSS. So that is this Community of Practice tomorrow, but we'll let Omar present, and then Sarah will give us more details if you can remain on the call an extra 5 minutes. Thank you. Go ahead, Omar. So Omar El-Farouk is the GBV coordinator in Libya, one of the two.
Yes, thank you so much, Jennifer and colleague, for giving us this opportunity to share one of the accomplishment and achievement that we did in consultation with the regional office. Actually, I'm going to present along with my colleague Anna. So I am Omar, I'm the GBV subsector coordinator. And please, Anna, introduce yourself.
Thank you. I'm Anna Crivellato, GBV program analyst supporting the GBV AoR in Libya. Over to you, Omar.
Thank you so much. Next slide. Yes, so basically we are going to talk about the secondary data review, definition of secondary data review, the rationale and the methodology, content, key finding, challenges, and way forward. Next. The secondary data for you, it's the process, all of you know that is the process of data collection, synthesis, analysis, and building on a desk review, all relevant information available from different sources. So basically, that is what we did. We collected all information related to GBV in Libya from different sources, and we did a kind of desk review, and then we analyzed this data. Next. Why we are doing the secondary data review, there is gap on assessment on Libya, so we need to build and bridge this gap by leveraging into secondary data. Also contribute to the knowledge with other sector. Also support the strategic planning by making this information available for the GBV subsector and also other areas of responsibility that might depend on such type of information in order to inform their decision. Also, it's a way of improving our understanding of the country and the context of the GBV in Libya. Next. The methodology actually we used the agreed upon the secondary data review tool that developed by the GBV area responsibility in consultation with the regional advisor, and here I'm referring to the regional gender advisor and the IOM, our information management officer, Mr. Yosto, and my colleague Taima, who contributed to this, thanks to them. We established what are information that should go into this tool, what aspect of the GBV that really we want to cover in order to shed some light on the GBV trends, GBV dynamics, GBV needs in Libya. Also, we consulted with them and we agreed on certain templates that to be used within the for this exercise. And based on their feedback, and we started the synthesis of data, and then we share this data with the, after that we identify the sources for secondary data review, and we reviewed number of sources, and it was a little bit difficult to balance between the number of sources that we consult and the number of the document that we cite. But finally, we managed to balance that challenge, and we come up with around 37 document that we cited for the secondary data review for our exercise. Following that, we compile all this information. We share it with the GBV subsector. We share it also with the other player on the ground. In addition to the our colleague from the regional office, as I mentioned, Taima and Yosto, personally they provided their feedback. That is the whole the process. Now my colleague Anna will walk you through the content and the finding. I see some comments are coming, but we will I will follow up on this, and then we will respond accordingly if there is any further follow up on it. Thank you so much. Up to you, Anna.
Thank you, Omer. Next slide, please. Thank you. So the result of all this process is a document comprising the following contents: a background, rationale, and methodology of the secondary data review, a conflict overview, a humanitarian profile, the GBV-related legal framework, gender roles, protection needs, and other GBV-related needs, the GBV perpetuating factors, coping mechanism, statistical data on GBV, the national GBV service delivery, the GBV humanitarian response, operational constraints, information gaps, and then the conclusions. Thank you. So we would like now to very briefly provide you some key findings of the situation of the GBV situation in Libya. Libya is a country that was affected by an ongoing conflict. In 2011, Gaddafi was overthrown. Then from 2011 to 2014, there were attempts to build a democratic state in Libya, but it ended with the start of a civil war that started in 2014. Only recently, in the end of 2020, provisional agreements leading to a solution to the war were reached. Now in March 2021, an interim unified government was established, and we are expecting elections in December of this year. Now, another analysis we did was we also analyzed how the COVID-19 pandemic has affected the population in Libya, and we saw that it has particularly affected the exercise of women and girls of their rights and their access to opportunities, and it has also deteriorated their living conditions. Due to the conflict and the COVID-19 pandemic, it is estimated that almost 153,000 people are at risk of GBV in Libya. Next slide, please. Okay, so further key findings are the traditional gender roles and naturalized discrimination against women in Libya. For example, women earn nearly 3 times less than men. For example, they are 4 times more likely than men to have never left their homes alone. They are less likely to be employed than men because of discrimination they face in the workplace. Another interesting finding is that Libya is party to several international instruments that promote women's rights and gender equality. However, the national Libya's legislative framework, it still continues to be discriminatory, and not all GBV forms are fully recognized as a crime. For example, marital rape is not recognized as a crime. Next slide, please. We also found out that GBV is highly prevalent, and evidence suggests that the main forms are conflict-related GBV, domestic violence, harassment against activists and leaders, trafficking in migrants to and through the country. There is a high incidence of sexual violence in various settings. We also found that early marriages are on the rise, and this is mainly because they serve as a financial coping mechanism, and it's seen by family as a way to ensure protection to girls in times of instability. We also find out that the conflict, the spread of violence, the insecurity have affected women's and girls' physical, mental, and sexual reproductive health, and that have faced great difficulties in accessing primary and secondary healthcare services. We also analyzed from an education point of view, and we saw that also girls are facing difficulties in benefiting from education because parents, for example, are reluctant to send them to school in certain areas because they are afraid that they could be abducted, attacked, or harassed on their way to school. And we also find out that the schools themselves do not have the adequate access to safe and gender appropriate wash facilities. Next, please. We also find out that women face challenges in obtaining justice after having suffered the GBV. For example, when they try to report GBV-related crimes, they often face discrimination, disbelief, or harassment. The conflict has also resulted in substandard and overcrowded housing conditions, what is increasing the GBV and health-related risks, especially for women and girls. Thanks to our secondary data review, we also could find out that there is a general lack of specialized government services for GBV survivors. And on the top of this, humanitarian organizations have really great difficulties to access people in need of assistance for both the ongoing conflict and the security context and the pandemic. Next, please. And over to you, Omar.
Yes, challenges as in most of the situation, GBV remain one of the top sensitive issues in Libya. Also, there is huge and significant gap on incidents related to GBV. We try to establish a GBV management information system. So far, we are having very few data gathering organizations, but we are working on that, and we are having plan in the future, in the nearest future, to conduct training on case management, and then also based on that to expand a little bit on the data gathering organization. Also, there is no recent need assessment, a part of the multi-sectoral need assessment that has been conducted last year, and this is also going to be conducted this year. But as you know, the multi-sectoral need assessment usually they don't focus a lot on the GBV issues. We tried ourselves for this year to make sure that also they will include significant indicators related to GBV services, and to unleash and uncover some of the GBV form. But again, this is one of the main challenges that really we are facing, the lack of information and assessment related to GBV. And this is also could be attributed a little bit to the situation in Libya, where there is really insecurity, especially in the past period. Now I think the situation is started to improve, hoping that we'll have the election and the smooth transition of power in December, so people can really access those who need and conduct the battle need assessment for people, and also see what is the situation looks in the Libya. Next slide. And the way forward, I mean, this secondary data review is going to be continuously updated. We will monitor to see if there is any sources, available new sources of information. Then we are going to update it continuously, and also we are going to use those findings to improve the response for the GBV management, and also to make sure that some significant part of it will go to the humanitarian response need. And I see some comments from the one, I think Jennifer mentioned that this type of information is very good for the humanitarian response. We'll make sure that we will make sure that this information it will find our way to its way to the humanitarian response plan. By saying this, thank you so much for all of you. And if you have any question, please feel free. Anna, do you have anything to add?
No, thank you. That's it from our side.
No, thank you so much. So please, if you have any question, clarification, please feel free to ask or type your response or your question in the chat box.
So we've lost about 11 people who had to go to other calls, and we appreciate the rest of you who have stayed on. And thank you, both Anna and Omar, for really making that very short and concise. It was packed full of information and really interesting. And I know that other coordinators will be getting in touch with you probably to learn more about your process. And we have been encouraging all of our countries to use secondary data reviews, because they are very useful, and there is a lot of information out there sometimes that we don't normally look at. So very interesting also to hear about your exploration of the treaty bodies, and what are the commitments made by the government. And I think that provides new advocacy points that we don't always take advantage of. So does anyone online want to make, I understand again, if people need to jump off, but is there anyone here who would like to make a comment or raise a question to Omar and Anna? I know we're late, but I want to give at least a chance if people have one or two questions. You can also write them in the chat, and I'm sure Omar and Anna will come back to you. So yeah, I see more and more people are needing to jump off. Please do write a question in the chat if you have, and then we'll respond. And I just want to give Sarah Mosley a chance quickly to talk about the session that will be on the community of practice tomorrow. Sarah, if you're still there, I see you. So thank you for your video as well.
Hey, I'll be very quick. So tomorrow at 3 p.m. Geneva time, the IRC together with the GBV Community of Practice is hosting a session on our new psychosocial toolkit, which includes guidance as well as an actual curriculum, a group-based curriculum for adult women that is grounded in feminist, grassroots, and survivor-centered principles. And it will also be on the GBV COP YouTube channel if you miss it. So thanks.
And then I just want to announce that it's great to see the turnout here, and please stay tuned. Our next call is going to have a thematic approach and will be on psychosocial support, and we'll see IRC there again with different people and different information. But also we're going to have Paula Ramirez, who has been doing very interesting work with frontline responders using mindfulness and wellness. I've heard mentioned here a couple of times about staff care and self-care. So we're going to have different partners talking. Also, we're going to have some of the presenters from our not quite yet task team on PSS, which is in the process of being created. So if you're interested in psychosocial support and staff care and self-care, please do make a special effort to join our next month call. We'll be sending out the agenda for that. So you'll see who all of the speakers are and what presentations are going to be made there. And do keep track of the community of practice as well, because we have also had some very interesting webinars on the community of practice. So thank you all for staying an extra 8 minutes, and we'll try to have less on the next call so that we can have more deep conversations following up presentations. And if you have anything else you want to, as an AOB, please do type it into the chat. So thank you all for joining our call, and it was really good to see the wide mix of geographic scope, as well as mix of global and field and women-led organizations and donors. I see we have at least one donor on the call as well. So thank you all for joining, and have a good week.
Thank you.